The next topic to discuss is how we move an arm. So moving the arm, we often will say either moving the arm, moving the humerus, or acting at the shoulder joint. So we have to be familiar with those three ways to describe movements that occur at the arm. There's actually 9 muscles that insert at the humerus and therefore move the humerus. We've learned a couple already. The deltoid muscle moves your arm, moves the humerus at the shoulder joint, primarily abduction, so movement of that humerus away from the body. If you recall, on the other side of this image would be the anterior side, since this is the posterior view. And at the anterior side, you would have the pectoralis major, which again is antagonistic to the deltoid. So it would be moving that humerus back towards the midline. So those two muscles are really important muscles to move the arm. They're very strong, powerful muscles that insert at the humerus. There's also, that's 2. Then there's 4 muscles collectively known as the rotator cuff. And we'll be looking at that in the next video. But the 4 rotator cuffs include the supraspinatus, the infraspinatus. Notice one of them is located above the spine. One of them is located below the spine. The third is called the teres minor. So it's a smaller cylindrical muscle. This is called the teres major, but that's not a rotator cuff. These 3 are rotator cuffs, and then there's a 4th called the subscapularis, which is seen on the other side of the scapula. So we'll have to look at it using an anterior view. So that would be 4. So you've got the deltoid pectoralis major, the 4 rotator cuffs. There's the teres major, which is not a rotator cuff, but it does still move the humerus. There's the latissimus dorsi, which is a wide muscle in your back, which helps to extend and adduct the humerus. So this muscle all originates along the spine here, crosses the shoulder, attaches to the humerus, and helps to extend, moves it posteriorly, back, like if you were to scratch your back, that's extension of the humerus. It also helps to adduct, it moves it in. Then there's a muscle that is in your arm right here called the Coracobrachialis. That's another muscle that actually inserts at the humerus. So all these muscles insert at the humerus, so they must help move your arm. We might as well go through the rotator cuff in this video. The rotator cuff muscles. First of all, we need to know there's 4. They're called rotator cuffs because if you look surrounding the shoulder joint are the tendons of these muscles, and those tendons that completely surround that shoulder joint help to stabilize the gleno or glenohumeral joint. So the rotator cuff muscles do 2 things. 1, they move your humerus. They attach to the humerus and they help you move the humerus. 2 is they help prevent dislocation. They help keep that humerus inside the glenoid cavity. You've probably heard of a number of people who may have torn their rotator cuff. So that's, these tendons can tear and that can be painful and can weaken the shoulder joint. It can also cause a lot of pain. So what are the rotator cuff muscles? Subscapularis. So notice that this is an anterior view of the scapula, whereas this is a posterior view. The subscapularis is on the anterior surface of the scapula. It inserts at that lesser tubercle. So that's that little knob here. It pulls that little knob towards the muscle, and that would cause medial rotation of the humerus. So medial rotation of the humerus would be spinning this humerus inward, turning that humerus in. The other three are found on the posterior side. Supraspinatus is above the spine. Here's the spine. There's the supraspinatus. It inserts at the greater tubercle. And if you pull that greater tubercle this way towards the muscle, that humerus will move away. So the supraspinatus abducts the humerus. Then below the spine, you have the other two, this infraspinatus and the teres minor. Notice that these two muscles originate in a very similar location underneath the spine. They both insert at a very similar location on that greater tubercle. But what they're doing is pulling that greater tubercle towards them, towards the muscle, which causes lateral rotation. Both these muscles laterally rotate the humerus, which is a kind of twisting away from the body. So these two, therefore, would be antagonistic to the subscapularis, because the subscapularis medially rotates, whereas the infraspinatus and teres minor laterally rotate. So these are the 4 rotator cuff muscles. The next video, we're going to then get into the arm. So we just learned about muscles that actually move the arm. But muscles that move the arm typically aren't found in the arm. They attach to the humerus and move it, but muscles that are in your arm, in your brachium, act more on the elbow joint. So when we get into the arm here, the brachium is used to move at the elbow.